Good morning, Peter Goertz. I'm a psychiatrist. Let's talk about working with violent psychiatric patients. And in general, you see these patients on locked psychiatric wards. In the clinic, it's a lot less common. Being assaulted has only happened to me once in my career, knock on wood. And the patient who assaulted me did it half-heartedly. He, in hindsight, had been bizarre. I would have benefited from being more aggressive, if you want to put it that way, with treating him with medication. He was only on a low dose of medication, and I'd seen him acting bizarrely in the dining room, bending over backwards while other people were eating. In fact, another patient at the time said, "Doc, he's having a seizure, do something." So in hindsight, you always have better vision. But luckily, this patient was half-hearted. I was in his room, which you always have to be careful about, on a locked psychiatric ward. And he said, "Shake my hand, doc." And then he would not let my hand go. And gradually, I was able to get to the door. And he didn't really, I forget what he did. He may have tried to get me in a headlock or something. But he didn't really fully assault me, luckily. But I'm not trying to scare you, but things do happen. I remember in the same hospital on another ward, on the prison ward actually, a male prison ward, one of the nurses got assaulted. A patient took a pencil and stuck it in her eye, which was terrible. Violence, of course, can also happen with patients amongst each other. And certain patients you don't really want to keep on a hospital ward very long. For instance, patients who have an antisocial tendency who are in the hospital maybe because they don't have a place to stay. And one such patient, actually, it's a strange story, and the medical student couldn't help laughing when he was telling me about his patient. This was a patient who may have not necessarily needed to be in the hospital, may have been there at least in part to have a place to stay. He got into a fight with another patient, had his jaw broken, his jaw needed to be wired. And also then another patient, while this patient was sleeping, another patient urinated on him, and the patient got up and slipped in the other patient's urine, fell down. So violence definitely can happen amongst patients. You want to trust your instincts, and if you're in a room with a patient, leave the room immediately if you feel things are getting to a point where you might get assaulted. If necessary, if you feel it's the right thing to do, have a large male staff member with you when you interview the patient. Be closer to the door when you're with the patient if you feel uncomfortable. And often other patients can help a lot when there's a violent situation. I mentioned that a patient was around the corner, a female patient with a broomstick about to assault me. And I didn't see her because she was around the corner, but another female patient came running. I didn't know where to, but she was running to the other patient to stop the other patient from assaulting me. So other patients definitely can help, other staff can help, and you want to really make sure you're nice to people. You want to make sure you treat people kindly, both patients and staff. Let's say if a patient asks for a glass of water, a cup of water, you don't want to feel it's beneath you to go and get that cup of water for the patient. And that's just basic courtesy, but that definitely can help you in your relationships with patients and staff, and also can decrease the risk of being assaulted. You want to try not to take it personal, even if a patient, you want to try not to take it personally, even if a patient assaults you. And something that can help me is just to realize if you're walking in a big city on the street and you see a patient, a schizophrenic patient, homeless schizophrenic patient, shouting obscenities to everyone who walks by, you're probably not going to take that personally. You're just going to realize, okay, this person has some serious problems and it's not about me. So you want to try and realize that also on our hospital ward, because even after the patient is assaulted, you still want to be able to work with the patient and treat them kindly. One very important thing, like I alluded to before, is to try and make sure there's enough medication in the patient's system. And that was probably not the case with the patient who grabbed my hand and wouldn't let go. And in general, patients do not want to be out of control. They don't want to be over-medicated, but they definitely, in the majority of instances, do not want to be out of control. They don't really want to hurt anyone. They're just out of control emotionally. So if you medicate them adequately with daily medication, that's the best way to go. If they need additional medicine, you can add that on as needed. If they really need it, they're going to have to be in seclusion or restraints, but you really want to minimize those things if at all possible. And different people have different methods. I remember one senior psychiatrist, he was about 30 years older than me. He'd been in that hospital for decades, worked with a lot of patients, including many assaultive patients. And I remember one large male patient standing in the middle of the hallway of the ward, really agitated, looked like he was about to assault someone. And this particular senior psychiatrist came up to him, and the patient was totally delusional, saying, "I want to leave, I have the deed to this hospital," totally convinced. And this senior psychiatrist, who was in his late 60s, walked up to the patient and asked him, "Shake my hand." And the patient shook his hand, and that grounded him. So it can work. Everyone has their own methods. I would not have felt comfortable doing that, because potentially it could have gone the other way, that the patient did not shake your hand and might have assaulted you. But for this particular psychiatrist, that worked, and it takes a lot of courage to do something like that. And I respect the psychiatrist for doing that. A population of patients that can be especially difficult to deal with regarding violence is people who have cognitive impairments. For instance, traumatic brain injury, intellectual disability, dementia. And you want to try your best to establish rapport with them, but that can be especially difficult. And I remember one lady, a lady with HIV and dementia, she greeted me one morning as I was walking down the hallway into the ward by throwing her feces at me. So this can be quite challenging, this issue of working with violent patients. It's not that frequent. Again, I'm not trying to scare you, but it's worth considering. Thank you.